take any questions.
Governor, you clearly made a mention to the autism insurance bill that didn't pass this year, and you'd like to get it passed next year. What strategy is it going to take to get that through the House of Representatives, where the Speaker apparently wasn't a fan of the bill this year?
Well, first of all, we were extremely pleased that the Senate stood up in a strong bipartisan way and by a vote of 29-3 passed a reasonable, appropriate autism mandate that would and could make a real difference for thousands of families that to date have not had access to services, have not had access to the kind of evaluations that are necessary, the life-changing evaluations that can develop an individual education plan that makes a difference for life. Literally the difference between the light going on and living a life in the twilight. I was extremely disappointed that with the Senate's leadership this year, and the passage of the measure through the House committee in an overwhelming fashion, and the passage of that bill out of the Rules Committee that was holding it after talking with them, that measure was never voted on this year. They had a lot of time to do a lot of things, and they didn't have time to do that this year. It was, as I mentioned in my post-session press conference, it was one of the things that I was extremely troubled by. We're just going to continue to press forward. This network is getting larger each and every day. The social science and the science showing how we can identify various pieces and parts of the autism spectrum is getting more real and more clear every day. Like I said, I think that the bill should have had a vote on the floor of the House, and it didn't. I'm not here to comment on why that didn't happen, other than to say that there were people that had power to have a vote on the House. And these families and thousands of families like them across the state deserve to see the Greens and Reds on the floor of the state of the House of Representatives on a reasonable bill that had gone through an overwhelming bipartisan fashion with great work by Senator Schmidt, and Senator Crowell, and Senator Root, and many others working tirelessly to make sure that this was not just some pie-in-the-sky bill. This was a well-crafted, well-thought-out bill that had a reasonable benefit that could been making a real difference right now. There are no excuses for the House of Representatives not to take an open public vote on the bill that was passed by the Senate last year. And I will use all of the force and power of my stunning personality to attempt to get that accomplished as we move forward. It needs to be done. Other states have done it. They've seen it jump forward, and Missouri needs to join them. I think there's a lot of people that have a lot of questions to answer as to why that measure didn't get a chance for the Greens and the Reds in the openness of government. A lot of people did a lot of work to put it in place. All it would have taken was one motion to put it on the floor, and it would have passed. And it is. It's a great disappointment to be, but more important, it's not about Jay Nixon or the governor, or quite frankly these reps or these senators here. It's about the thousands of folks out there who don't have access to the services here. It's about the 2,500 or the 25,000 others, other than the 2,500 families that have already worked through this network that haven't had the access to early analysis, early testing, early reviews, so that the kids can lead a much more fulfilling life. And like I say, it will be mentioned and mentioned again, and we will marshal every bit of pressure. Folks that refuse to this importance, in my view, deserve to be called out.
How difficult will that be, though, to get a vote, as you just mentioned?
They don't have any arguments against it. The only argument is the insurance industry doesn't want it. And that's not an argument. Okay? That's a position that a special interest is taking for their own special interest. They're wrong. We're right. We're going to continue to press this fight in the light of the day, and it's my hope and expectation that about 365 days from today, we'll be right here signing that bill. I expect this is, I never have understood why it was such a hard lift for an industry to be asked to provide a product they can sell for a profit. I never have understood why, if citizens of Missouri have Alzheimer's, that's covered. If citizens of Missouri have Parkinson's, that's covered. If you or I have some sort of heart condition, or that we cover appropriately, cover mammograms, cover prostate screenings, all things that have shown not only to save lives, but to save money. This one fits right in that zone. When you compare the life that is led by someone who has had early intervention, appropriate education, early access, and family support, those folks are leading independent lives, okay? They are not leading lives, many of them are not leading lives in which they are in any essence wards of the state. They are assets of the state, each and every one of those folks. And we have a moral and political responsibility to make sure that they get to see the same world that we do. And I am up to here with that there haven't been any arguments on the other side, other than the industry doesn't like mandates. Well, we got through mammograms, we got through prostate screenings, we got through some mental health coverage, we've gotten through a number of things, and it's time to get this one through.
Governor, you mentioned that you wanted to sign it 365 days from now. Would you consider calling a special session to get it done sooner?
If we could reach consensus that would get a guarantee that it had a vote on the floor, I certainly would. I'm not going to have the taxpayers pay their hard-earned dollars to bring people back to town if all we're going to see is the same show we saw this year.
How much is